Well, we're going to take a little health moment. So I just saw a very interesting guy today. He's taking a very low dose of a cholesterol pill. I personally take about 40 milligrams of cholesterol. He just takes 10. His cholesterol is well controlled, LDL cholesterol approaching 1, which is wonderful. He has diabetes, increasing his risk of heart disease. And he had an asymptomatic rise in his CK to 993. Now, normal CK is up to about 300 range, and we know that CK is a muscle enzyme in part, and basically it rises from exercise. He has a very vigorous jaw, so it can go up because of that. He had no weakness, no muscle symptoms whatsoever, no soreness, and again, statins can affect the muscles very rarely. We say that 1 in 2 million people will die from muscle problems from statins. So you can see it's extremely rare. Been doing this for about 30 years plus, and I've seen maybe 25 cases of what we call severe muscle problems, where the CK goes up in the 10,000 range. But this was a small rise in CK, and the week before I saw another person who had a CK rise of 1600. He just went to his personal trainer, and his CK went up to 1600. We didn't change any of his dose of medication, and in a week later, his CK is actually normal, and his muscles were sore from exercising. So the message is we measure muscle enzyme to watch for muscle toxicity, extremely rare, and usually I don't do anything till above 2,000, or if there's actual true muscle weakness. So unfortunately, his doctor stopped the very important medication, and it was probably just the background of life that caused the muscles to go up. So that's an important health moment for everybody to be aware of. So before you change medications, it's best to talk it to the doctor who prescribes it to you in the first place, not somebody else who's non-expert, or not to somebody else, a friend, next door neighbor. The pharmacist can list any side effect, but doesn't really always know the common side effects. So if I start you on a medication, you have a problem, call me. Glad to talk it with you.